Thanks, Donna, and thank you, Research America, for inviting me to take part in an important conversation. And I'm pleased to be joining the two of you, Congresswoman DeGette and Congressman Upton, to learn more about your work on Cures 2.0 and its intersection with the pandemic. Also invite your perspective on the proposed ARPA-H initiative. So let's dive in. I know that you and your staff have put a lot of time and effort into crafting Cures 2.0, building on the landmark 21st Century Cures Act that you championed in 2016. Patients and those in the health and research ecosystem recognize you as extraordinary advocates, well-deserved recognition. You lend your time, influence, energy to addressing the misalignment between the value of faster medical progress and the priorities assigned to it. Now, the 21st Century Cures Act is credited with accelerating major moonshots like the BRAIN Initiative and essentially resetting the discovery, development, and delivery pipeline to help it move at the speed of the possible. And now you're working on Cures 2.0, another bill that's clearly grounded in the belief that our nation can and must push harder to advance medical and public health progress. Like 21st Century Cures, it's a collection of the needed and promising initiatives, so many good ideas. In fact, it's hard for me to pick and choose which ones we want to talk about today. So with that said, I'll get to it. I'll begin with your proposals related to the pandemic preparedness. And Congresswoman DeGette, let's talk about some of the key objectives here, including making some of the pandemic telehealth provisions permanent. What lessons have we learned over the past 18 months? What positive policies were put in place recently that we can build upon with Cures 2.0?
Well, Randy, thank you so much for moderating, and thanks to Research America for having this important discussion. Mostly thanks to my compadre, Fred Upton, for all of the hard work, both in 21st Century Cures and also as we've been developing Cures 2.0. One thing that we realized when we got into the pandemic was how important 21st Century Cures was, because many of those provisions actually helped us to develop the vaccine as quickly as we did through the administration's Operation Warp Speed. And it also helped with many other of the provisions of dealing with COVID. But one thing we learned throughout the process was that we just have to be better prepared in the future, because we don't think that COVID-19 is going to be the last of the potential pandemics that we have. And so some of the language that we've put into our draft bill, Cures 2.0, directs the Secretary of HHS to convene a national series of meetings to serve as the basis of an ongoing learning collaborative that will help us understand COVID at a very deep level with key sectors of the healthcare community. It also will require development of a national strategy based off of the lessons we learned in COVID-19 to mitigate future pandemics and public health emergencies. And it also creates, and we're really excited about this, a pandemic preparedness rare disease support program to provide additional assistance to individuals who have rare diseases and their families during future health emergencies. And, as you alluded to, delivering healthcare virtually provided a critical way for some patients to access needed care during the pandemic. And so what we're doing is we're aiming to ensure that patients and providers can continue those telehealth services in Medicare, Medicaid, and in the CHIP program, regardless of where they're located. So lessons learned, we're hoping that we can codify some of this in 2.0.
Boy, that is so encouraging, Congresswoman. I mean, I'm really seeing a silver lining emerge with this terrible pandemic in so many ways in which it stressed our system, really called out inequities in healthcare, the special challenges of those persons with rare diseases and autoimmune conditions. Sounds like you're really looking over the horizon to help us not face that uncertainty again, which is terrific. I'm also understanding that the bill addresses the potential for another global threat, And that's one that could act with greater stealth and literally take the lives of hundreds of millions of people annually. What I'm referring to now is that serious threat of antimicrobial resistance, or AMR. That's something I've come to learn more about over in recent years, and it's pretty serious. I know the first roundtable discussion in this forum focused on strategies to slow that corrosive effects of drug resistance. And my understanding is that the provisions in Cures 2.0 would attack this problem, but from a different angle, that you'd look at barriers that to developing antibiotics that we could actually address and, again, meet that problem head on. Congressman Upton, could you talk to us a little bit about that AMR approach in Cures 2.0?
Well, we have a special provision in here. We know we've all learned a lot. And I got to say, thank you, Research America. Thank you, Diana. And thank you to our staff. I mean, they've been tremendous every day for actually now a number of years. But a couple of things, as we look back, when we did Cures, the last bill that Obama signed into law in 2016, it had been a 2 or 3 year process that we started. We had lots of meetings and roundtables and hearings literally all over the country, not only the two of us, and we went to each other's districts and been there a couple of times, but so did the other members of the committee. I mean, we went to MD Anderson and Harvard and Mayo Clinic. I mean, we went to University of Michigan. We went everywhere and we listened and came up with a bill that passed 392 to 26 in the House, 92 to 8 in the Senate. Now we've taken the last 2 years, and we were slowed because of COVID. Let's face it, what didn't get slowed down? What can we learn more? So this microbial issue, we know a lot more about it than we did before. So let's address it. Let's hit it head on. Let's have a special provisions. Let's have an emphasis on this that we didn't have before because we weren't as knowledgeable about this. It wasn't on the front plate like it is today. But again, when you look back, Pfizer's my largest employer. They actually produced the vaccine in my facility in Kalamazoo, Michigan. Diana's been to Kalamazoo. She met with my Pfizer folks when she came here, and we did a major round table with Francis Collins and the FDA and others there as well. And when you look back, the reason we all were so excited when that vaccine got approved in December of 20 was that was a direct result of what we did with Cures. Not only did we expedite the approval of that drug, but we also allowed, because of the emergency use authorization, the EUA, the ability of any of the pharmaceutical companies, J&J, Moderna, obviously Pfizer, to actually produce it prior to the approval. So that when it got approved, it was bingo. It was on those trucks and was on the way to everywhere across the globe. And I was there just a couple weeks ago now, and one freezer contains 350,000 doses of that. And the day that I was there 2 weeks ago, they were actually sending vials of the vaccine to Africa. It was incredible. It was going to be there before the end of the week. And so what we want to do now is, what did we miss before? What can we do to further expedite that? But let's use some of the tools that we maybe didn't have back then. I mean, you talk about broadband. I can remember talking to some physician groups during the COVID issue when it was real big time. And one of the physicians, she told me, she said, I'm so glad that I can communicate with my patients online so they don't have to come here to the Bronx. I was at one of my local hospitals last week. The patient communicated with his doctor with a neurologist online. She wasn't in the office. She was able to ask the patient direct questions, able to look at things, able to communicate. Broadband and telehealth are so important. What can we do to push this ahead even further? You know, I really wasn't around in the 50s when they developed the interstate highway system, but communities that didn't have it didn't thrive.
Right.
It's the same thing now with broadband, which is why it's so important. Not only this bill, and we're going to have an emphasis on telehealth, but we're also seeing, as we hopefully pass an infrastructure bill, that we have billions of dollars in that for broadband to connect communities, whether they be an urban or a rural setting, depending upon their ability to access those speeds. So, but on the microbial issue, yeah, we're going to have an emphasis on that. And like we did on the first version, we hope that this is overwhelmingly bipartisan as we really look to introduce it this month in September.
Boy, that would be great, Congressman. It's so good to be able to see the payoff of that vision that took place in 21st Century Cures, then literally lead to the savings of millions and millions of lives and the mitigation of this pandemic earlier than we could have ever expected otherwise. And I think, for the National Health Council, we partnered on legislation around patient engagement. That's so critical into every step of what we're talking about here. The 21st Century Cures created a paradigm shift. It really put patients at the heart of research. And for us, that was a huge victory and so critically important and meaningful to patients. What are the goals of Cures 2.0 for patient engagement, especially as they relate to health literacy, let's say, in clinical trials?
Well, as you said, in 2015, we were looking at discovery, development, and delivery of these groundbreaking discoveries and treatments. But what we wanted to do as we developed 2.0, and one of the real cornerstones of the bill, is to try to do everything we can to make sure that patients' voices are heard throughout the clinical trial process, because after all, listening to patients is the best way to be on the road to curing their disease or condition. And so the other thing, and Fred talked briefly about this with the expansion of telemedicine and electronic medical records and so on, if you can collect patient experience data and apply it through product development, that can really make sure that patients' needs are addressed. And so 2.0 requires manufacturers to collect and report on patient experiences as a part of the clinical trials. And then it also requires the FDA to consider that data in the regulatory decisions. I do want to stress, because I always stress, though, as we collect this data, we need to make sure that patient privacy continues to be respected and protected. And so we do that as well in the bill.
I just want to add one other element to what Diana referenced, and that is, when we did the vaccines, there still is, let's face it, a reluctance by millions of Americans not to get it. And we're glad that the EUA is now over, that they gave FDA gave formal approval earlier this month. But one of the issues that we saw, particularly with people of color and other minorities, was they felt that they were left out in the trials. Now, remember, when we did Cures, we didn't allow any shortcuts. That, the FDA safety requirements are all still in place. You still do the 30,000 individuals for trials that happened with all of the vaccines in this particular case. But like we saw with breast cancer back in the 80s, when so many breast cancer studies were actually, 1 in 8 women, breast cancer candidates, yet a majority of the studies were actually conducted on men. Yes. I mean, something, like, how did this happen?
Right.
So one of the things that we have is an important element here, particularly as we reach out to groups like the Congressional Black Caucus and others. How do we get everybody included? And so we have an emphasis now, where we didn't before, on making sure that these trials are fully diversified, so that there's no excuse for someone to get the vaccine based on the scientific evidence that's presented.
Absolutely. There's so much truth in including people early on and comprehensively is going to deliver a different result then, as they understand that their community contributed to the learnings as well as the approach for treatment. What about the role for caregivers in that space? Because they're very influential with patients as to whether they're hesitant or move forward with treatment, their role in the clinical trials themselves as part of the healthcare team. Does 2.0 touch on caregivers in that space?
Well, caregivers are going to be part of the whole process of the information, the development, and then the process of putting it in. So caregivers are always a part, as we know.
Terrific. That's great, because it really is a partnership. I mean, patients occur in the context of family and communities. And for us to be effective, when we talk about patient engagement, it has to mean the caregivers and the people around them, of course. Kind of related to that is, are there key provisions in the bill that look at regulatory science and the intersection with the FDA decision-making process, and then how insurance coverage kind of follows? I know you put these provisions in, you've touched on it. What led you to include those provisions that help align FDA approvals with insurance coverage decision-making?
Well, let's face it, it's not worth finding a cure necessarily if we can't find a way to make sure that people can afford it and have access to it. So hopefully you'll see some positive changes with regard to that, so that majority of people won't feel excluded. Oh, isn't it wonderful we have a cure, but if no one can have access or be able to afford it, what good is that going to do to that family that's suffering because of the family member that might have that particular ailment? So hopefully we're gonna see some positive changes in that regard, and work with the industry and others to make sure that in fact these new cures really do work. And you got to remember, at the end of the day, so take cystic fibrosis, marvelous breakthrough a couple years ago now, for 90% of the people that are there. So that means we've again extended the longevity of folks that are inflicted with that terrible disease. And think of the savings. Think of the savings by having productive people that can now get into their 30s and 40s instead of having that death sentence before they were really in their early 20s. Same thing with sickle cell.
I was just going to say, and the key to unlocking a lot of the private insurance decisions is really CMS. And one of the things that we wanted to do in our first bill, but it just wasn't developed fully, is to look at CMS reform, because if CMS decides to cover a device or a drug, then that has impacts on private insurance and on the whole industry. And so in Cures 2.0, we are looking at ways to modernize CMS so we can speed up that agency's decision-making process so it can provide faster and more predictable decisions on some of these new therapies that are so exciting for the patient community.
You know, absolutely. What I'm hearing you say is you're taking a very holistic look at not just patients and the ecosystem that they operate in, but the systems around them, be it in the private sector or in the public sector. And by taking that holistic look, we're not going to be siloed. We're not going to have parts left out that would have been critical. I really appreciate just how you're addressing these issues in 2.0. Lastly, let me talk to you about the ARPA-H conversation, the Health Innovation Incubator that President Biden has proposed. What's your vision for that particular proposal?
Well, we're excited working with the Biden administration and the president directly on this. In fact, I think we're probably the first bipartisan group, just a handful of us, Republicans and Democrats, House and Senate members, Diana and myself were included, to really talk about this exciting proposal, which we will have included in our proposal, in our draft, in our bill when we introduce it a little bit later this month. So it includes a new innovation, a new, I don't want to use the word agency, but I will. And it'll be, it's independently funded, very much along the lines of what DARPA did for the Defense Agency back in the 50s. And Diana and I have spent some time talking with former DARPA officials. How is it that we can establish a new agency that's nimble enough to really react quickly to fund cures initiatives that may be the breakthrough that we all want for different diseases? And the president wants it included within the NIH, so that's going to happen. But we're going to make sure that it's independent enough in that they can chart their own course. The more exciting news is that the appropriators now, and there were some of those members, again, in the meeting in the Oval Office with the president and the vice president, they've included billions of dollars for this initiative. Biden talked about it in essence in his State of the Union address this last spring. We're going to deliver, and it is our absolute aim and goal to have this bill, including ARPA-H, on his desk before this year is out.
And let me just add, we're excited about the potential of ARPA-H as an independent agency that can address some of these thorny issues, cancer, Alzheimer's, Parkinson's, so many issues in a streamlined way. But we also recognize that the importance of the ongoing research at NIH. And so what we don't want and what we will not tolerate is an agency that either gets subsumed into the NIH or an agency that where the funds become fungible between the agencies. It has to be a separate effort that will set its agenda and be targeted. And so that's why we believe not only is it great that they have the money in the appropriations bill, but we need to have authorizing language setting up this type of independent agency so that they can collaborate with our existing federal agencies, but will not be a substitute for it, won't take away from it, and won't be subsumed into it. So that's what Fred and I are working on. Our wonderful staffs have drafted up some great language in consultation with the administration and also in consultation with many other groups, as Fred said, including people who have headed up DARPA. So we're excited about this because we think it'll be a good augment to the research that we're doing right now in this country.
And just one thing to add, we don't want it to compete with the NIH funding. That's why it's important to keep it separate. And when we did Cures, Diana and me, we added $45 billion to the baseline over a 10-year span for the NIH research on top of what the appropriators already had done. So we're going to make sure that NIH funding stream is strong, but this is going to be a separate group, and we're going to hopefully this is going to work as well and just get to the end result that all of us want.
Well, I couldn't agree with you more on that. You know, you're really bringing to patients a sense of hope and a sense of hope for all of those around them. I sense momentum, I sense energy, a visionary approach, but holistic and pragmatic. And you're building on past thinking that have demonstrated success, certainly through 21st century cures and what we saw in addressing these early stages of the pandemic. I'm so inspired by the two of you and the work that you're doing. Thank you so much. I know we'll have a lot on our plates as we come back from recess. Know that we'll be with you. You can count on the patient community, the research community. We're aligned on this, and I think the results that we'll see down the road are going to tell us that we're in absolutely the right place with the right ideas at the right time. So thank you both so much for all that you're doing on behalf of patients, the research community, the potential of the American system, American society, to be there for our vulnerable citizens for greater health, greater productivity, and greater good. Thank you both for all that you do.
Thank you so much.
Absolutely.
We're going to need your advocacy to make sure that we get the Republicans and Democrats on board to pass this bill too. So we're not done with you yet.
We're up for it. I think that bipartisan support is exactly the winning ticket that we've seen to be so successful in the past. We need that today. Thank you so much to two of you, Congressman Upton, Congresswoman DeGette. We really appreciate you and the good work you're doing. Thank you.